I've just been looking lately into ALS, and when you look at something like ALS, which is a progressive neurologic disease that often can have dementia as part of it, but
So
and
heartbreaking.
some of the same genes that will lead to ALS can lead to frontal temporal dementia in a different person.
Right.
And so the genes are only about 1% of people with ALS have a gene that causes ALS. The other 99% have a conglomeration of issues that led them to the same outcome. Okay, so it just depends on how your body deals with stresses, and that's what gets, that's why people are so frustrated, and why medicine in general does such a poor job, because medicine is aimed at what happens in 90% of people, 99% of people. And so that's why they keep failing, because they're only looking for solutions that work for large groups of people. And that's appropriate if you're going to use a toxic drug. But, from your work and Dr. Bredesen's work, we clearly see that for most people, if you just work on toxin load, diet, stress, and supporting, you can make big changes, because as you remove the toxins, then this cell danger response process can work normally. Because usually I shouldn't say usually, but often there's an underlying toxicity, an underlying stress that has that's too much for that system. Like you can measure, for instance, people look at glutathione, and you can see that people who stay sick have very low levels of reduced glutathione, the part of glutathione that you need to help fight a viral infection or to help deal with oxidative stress. Okay, so there's something that's sucking it down, or there could be a gene that's not allowing it to be made as effectively as it can be. But what makes chronic disease different than acute disease is that if you have pneumonia and we see the bacteria that you have, we give you the right antibiotic that kills that bacteria, and 99% of people, depending on how old you are and how depressed, but people get better. Okay, rather straightforwardly. But in a chronic illness, it really becomes a game of individual pick up sticks plus pin the tail on the donkey.